Heart failure is a complex disease that carries a huge mortality burden, and the need for improved phenotyping in heart failure has been increasingly recognized and stressed in the recent guidelines. A commonly encountered disease in patients with heart failure is ischemic heart disease, which on its own is associated with a high mortality. Understanding the intersection of these diseases, heart failure and ischemic heart disease, especially on the basis of molecular profiles in addition to the clinical profiles, is critical for adequate phenotyping. My name is Kayode Kuku. I'm a Post-doctoral Fellow at the Heart Disease Phenomics Laboratory at the National Institutes of Health, the National Heart, Lung, and Blood Institute, within the Epidemiology and Community Health branch. I am delighted to be here to talk about our article titled Proteomic Profile of Ischemic Heart Disease in Heart Failure, a Community Study, that will be appearing in the July 2025 issue of the Mayo Clinic Proceedings. This work was done alongside colleagues and mentors from the NIH and the Mayo Clinic. In this report, we addressed a critical gap in heart failure phenotyping by evaluating the clinical and molecular profile of prevalent ischemic heart disease in patients with heart failure. The key message is that we uncovered distinct molecular profiles and novel biomarkers of prevalent ischemic heart disease in heart failure and the intersection of these biomarkers with known cardiovascular risk factors. To do this, we leveraged a well-characterized community cohort of almost 1,400 patients with a diagnosis of heart failure from the Rochester Epidemiology Project, enrolled between 2003 and 2012. This population had extensive longitudinal data and available plasma collected at enrollment. We measured high-throughput plasma proteomics using an aptamer-based high-affinity platform that included about 7,000 human protein targets. We defined prevalent ischemic heart disease in this population by a history of myocardial infarction, documented history of angiographic coronary vessel disease in any of the major epicardial vessels, or revascularization by percutaneous coronary intervention or coronary artery bypass graft. The prevalence of ischemic heart disease we found in this population was about 50%. With respect to the cardiovascular mortality outcome in this study, we evaluated Cox proportional hazards model adjusted for demographic factors, including age and sex, as well as the clinical risk score, the MAGIC risk score. The presence of ischemic heart disease was associated with a higher risk of 5-year cardiovascular mortality in patients with heart failure with reduced ejection fraction, with a hazard ratio of about 2 in both models adjusted for age and sex, and a model adjusted for the MAGIC risk score. However, there was no significant association with cardiovascular mortality in patients with preserved ejection fraction. Interestingly, the duration since heart failure diagnosis did not influence these relationships. In the proteomic analysis, we identified 52 unique proteins cross-sectionally associated with the presence of ischemic heart disease, even after accounting for age, sex, and renal function. This included known biomarkers such as PCSK9, troponin I, and renin. However, we identified several other emerging and novel proteins that had not been previously linked to heart failure or ischemic heart disease. We were also able to tease out the association, the links of these proteins with those that were associated with cardiovascular risk factors such as smoking, hypertension, obesity, hyperlipidemia, and diabetes. Now, putting these findings in perspective, we studied a population that represents the real-world experience of patients receiving care at clinical centers and hospitals across the states, and that includes the entire heart failure spectrum. Thereby, we optimize the clinical relevance of our findings. By utilizing a large discovery platform for proteomics, we made a huge effort in maximizing the molecular inferences that could be drawn from our results. In terms of what's next, we uncovered several novel proteins, and those will need to be validated in other diverse populations and in genomic studies in order to make causal inferences. Our pathway analysis also pointed to several biologic processes and pathways represented by the proteins we uniquely identified in relation to ischemic heart disease and with cardiovascular risk factors in heart failure. This, we believe, will form a priority list for future investigations as potential mechanistic targets. Clinically, these findings highlight the prognostic role of ischemic phenotype in patients with heart failure and imply strong considerations to be made in the management and surveillance of patients with heart failure with a coexisting prevalent ischemic heart disease. I'm going to say that this important work was done by a large community of people. Some of them are co-authors, but many of them are not. I just want to acknowledge the efforts of everyone at the National Institutes of Health, as well as the Mayo Clinic. And thank you for listening. And I would invite you to check out the full report. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.